Our first question today, can we email patients during COVID? So the question talks about, can we send an email to our recent patients to inform them that we are open during the current COVID restrictions? Now, remember that when you collect a patient's information for the purposes of providing a health service, then you can use that email address for the purposes of providing a health service. Now, in my opinion, that if you're reaching out to recent patients or clients to assist them with their current healthcare questions, it's okay to send an email to your patients or clients to let them know how you can provide health services within the current pandemic restrictions. Now, if you are collecting emails for a different purpose, perhaps you're offering them access to online courses or additional resources, or to buy replacement parts for equipment, then you have some different rules to follow in your marketing. And if you're going to reach out to patients, I do encourage you to get an email consent for the purposes of a health service and for the purposes of other related information. So if they are coming to you because they had an injury while they were biking and you'd like to share with them some engaging information about cycling tips and the best routes to follow in your community, then keep the email that you are using for their health service to remind them about their upcoming appointments on a separate system, probably your EMR system, and then the engaging articles and other pieces of information on a separate marketing email platform. So that is your autoresponder system. So that way you're very clearly keeping the email address that you collected for the purposes of providing a health service to let them know about their appointment reminders and other resources to access you for their health service in your EMR or your practice management system. And then you can clearly identify and contact those patients for those different purposes. Now, certainly we have a lot of things that we are doing different in the times of COVID, and reaching out to your patients to let them know that you are still there to help them with their current problems. Perhaps something new has come up. Maybe they've got questions about COVID or something else. We still continue to get sick and have accidents, and we still need our healthcare screening. So absolutely, in my opinion, I think it's totally okay to send an email to your patients to say, we've been thinking about you. Have you been thinking about us? Do you need to come back and see us? And then that gives you the opportunity to open the doors to explain how you're doing your business differently and safely. So a couple of pointers or suggestions for you is that we know that patients may be reluctant to see their healthcare provider in person. I had a friend recently tell me that, I know I'm supposed to go and see my doctor, but I keep pushing off this appointment because, they say don't gather in groups so that you don't get sick. And I don't want to be in that waiting room and waiting for an hour. Well, she may not realize that the doctor has changed their practice so that you're not in a waiting room with 30 other people anymore, that you've changed your practice. So this is a way about being able to reach out to those people to let them know that if you still need to see us, we're still here. We may be doing our business a little bit differently, but it is safe for you to come and see us. They might not know that you've got some alternate processes available to them. So maybe there's the opportunity for a phone visit or a video. And I think this is a great way to be able to demonstrate that you're thinking outside of the box, that you're providing services in a new way. And this might be the way that we continue to provide services. I find that it's great to be able to have a chat with my doctor just to renew the medications that I've been on for, most of my life without having to go back and see him in person. It's far faster for both of us. And I know that if I've got any questions or anything new pops up, I can make an appointment to see my doctor in person. So there are some new things that we are doing in our practice. We're only letting people in immediately prior to their patient appointment so that they may have to wait in a car. So we want to have that engaging conversation with our patients to let them know, what does that mean for you today? Is it safe to wait out in the car? It's cold outside. How else can we manage that information? If you don't have a car to wait in, that's another problem. So where can they come in a place that stays warm and yet socially distant? So yes, you can email patients during COVID. Now, make sure whenever you are collecting patients' email addresses that you are collecting their personal email address. Do not collect their business-related email address or the work-related email address. You never want to be in a position where you are sending patients' information to their bosses. We've got a lot of changes in email conversations. A lot of people are laid off temporarily. Perhaps they've lost their employment. They've got new jobs. Their work-related email addresses are not consistent. So do not accept those emails. So I had somebody ask me just the other day, well, the patient says that this is the only email that they check and it's the only one that they want to use. And you go, well, that's fine. You don't want to accept a work-related email address. If they can't give you another alternate email, then that's not a service that's available to them. You get to decide who you're going to send the emails to. So if it's not a personal email address, then don't collect it. And if they complain that they can't get their appointment reminders by email, they say, I'm sorry, give me a personal email address. I'll be happy to send you your appointment reminders.